since like 3 years.
Wonderful, that is. And you are a mentor for many of the students. It's wonderful.
Yes, it's many.
Yeah.
Sir, Prashant sir, please take a pause of 2 seconds and then start your speech.
Okay. Hello, good afternoon, doctors. On behalf of Hetero Healthcare, I, Dr. Prashant Khandeparkar, welcome you to this webinar on recent advances in intimate health management. Doctor, as you know, lifestyle is changing, and so are lifestyle-related diseases. And intimate health management becomes an important part in the life history of a lady. At Hetero Doctors, as you know, we market products in multiple therapy areas, like in gynecology, dermatology, gastroenterology, pulmonology, and ortho. We have a very strong R&D background, and we try to develop products keeping patient benefit in mind. Our endeavor is to improve patient compliance and hope ultimately to improve clinical outcome. We have developed NSAID patches, reverse segment patches, keeping patient compliance in mind. Gynecology, obstetrics, and IVF is an important therapy segment for us as Frenza. Apart from oral tablets like Didropal and Mylutin, we market products for vaginal health like Femonara and Pellitra. Recently, we have introduced a vaginal film under the brand name Celero. The film contains lactic acid along with fructooligosaccharides and tea tree oil. The film is supposed to correct the vaginal pH and maintain it at an acidic pH so as to protect vaginal film from infection. To speak more about vaginal conditions requiring vaginal film, product, and share clinical experience, I have the pleasure in inviting Dr. Preeti Poghe Bharude. Madam is MBBS DGO, MRCOG, FMAS, Fellowship in ART. Importantly, Madam is mentor for gynecology during MRCOG. So qualified gynecologist trained in IVF. Madam is also trained in emergency obstetrics, high-risk pregnancy management. Dr. Preeti has presented papers in several conferences like MOGS 2009, 2010, AMOGS 2011, IUI, NSV, and postpartum IUCD workshop in BMC Mumbai. I have the pleasure in welcoming Dr. Preeti. Welcome, Dr. Preeti Poghe Bharude. All yours. Thank you.
Thank you so much. Thank you so much for that kind introduction, Dr. Prashant. So, as you said, recent advancements in the intimate health management of a woman are very important. Why? Because this is the area which is very less spoken about, and generally people end up giving the same prescriptions again and again and coming up recurring. It is a recurring thing, and not every time the patient is going to come back to you with the same complaint. Sometimes she is going to say that, how many times am I going to go for the same problem? And that is why it is very important to start from the scratch, to make them aware from the scratch, and to use a product which is going to give least of the visits for the same reason to the gynecologist. Correct? So starting with my presentation. Intimate hygiene. So intimate hygiene is all about keeping your private parts clean, of course, and daily gentle cleaning of the vulva is again an important part of feminine hygiene. May I go ahead? Yeah. So vaginal pH is the key. So we all know that vaginal flora and vaginal pH, they go hand in hand because it all depends on what kind of flora is there inside the vagina. So the pH completely depends on the vaginal flora. Let us go ahead. The vaginal flora has got a lot of vaginal microbiota and the microbiomes, and not all of them are good. Some are good, some are bad, right? So all these bacteria which are there inside a healthy vagina, they are responsible for maintaining the vaginal pH. And the good bacteria, which we generally call in lay language, is the good bacteria, which is lactobacilli, right? So why this is important? Because it is important to produce lactic acid, which maintains the vaginal pH. What is the basic vaginal pH it is around 3.5 to 4.5, correct? Which needs to be maintained once, which is acidic. It is responsible for maintaining the healthy vagina. Once it starts becoming alkaline, which is responsible, which occurs in many cases like having vaginitis, or patients when they go through periods, or many other different things which will come across in the coming slides, will see that this pH is not maintained and it becomes alkaline. So once the pH goes more than 4.5, which becomes alkaline, this vaginal problems start happening and patients start experiencing the problem of vaginitis. So that is why this vaginal pH is therefore determined by the sum of lactic acid production by the vaginal mucosa and the total microbial flora. So basically, healthy vagina is a balanced pH. If you maintain a balanced pH, you have a healthy vagina and less vaginitis. So how is this production of lactic acid happens, and how it helps to prevent the vaginitis? So basically what happens is the estrogen that is present inside, the estrogen hormone that is present there inside a female body, it acts on the vaginal mucosa and it causes the production of lactic acid because out of glucose. This lactic acid bacteria, it acts on the glucose which is produced by the vaginal mucosa, and this lactic acid is actually important to maintain the pH, also helps to increase the number of lactobacilli, which will help in maintaining the vaginal pH. It will also reduce the other unimportant microbiota like Gardnerella or Prevotella, which are not very useful. Again, they may cause, if they increase, then it will cause increase in the vaginitis or bacterial vaginosis. So it is basically important to reduce those things. And that is why the more the production of lactic acid, the more the healthy vagina is. So what happens is this lactic acid, it hampers the growth of pathogenic bacteria, correct? It also colonizes more lactic acid bacteria. It induces the lactobacilli growth, and finally it creates an acidic environment which we require between 3.5 to 4.5. So that's that we maintain the pH. If we maintain the acidic pH, there is less chances of us having vaginitis. The normal vaginal flora, the acidic vaginal pH, and the vaginal discharge, all these three together, they are the components of innate defense mechanism. We know that every female, she has got some kind of vaginal discharge, but she should be able to differentiate between a healthy and a non-healthy vaginal discharge. Every female is going to have vaginal discharge during her in her 1 month of period. But what is important is what kind of discharge it is. Okay, it shouldn't be smelly, it shouldn't be causing irritation, it shouldn't be causing itching. So all this, if the patient comes with all these symptoms, of course we know that there is some problem either with the vaginal pH and it has caused some problem with the microbiota, correct? So let us go and see what is the pathophysiology of a disturbed vaginal pH or a vaginal health, why it gets disturbed. So we know that there are many risk factors, especially in a woman's life. She has to go through a lot of things at one single time, specifically in the reproductive age group, right? So these age factors, again, the lifestyle, specifically here now because of the rainy season and dampened conditions because of the moist environment, again, we end up having less hygiene, maintaining less hygiene of the vagina because all the clothes are damp again. So most of the time, these vaginal problems, they do occur in rainy seasons, correct? So this is the correct season to actually take up this PPT. And in such conditions where you have a lot of risk factors, right? Where you're sitting for a very long time in sedentary lifestyles, where you're actually not able to walk around, there's less mobility. Again, there is a lot of disturbed vaginal health. So what happens here is, when in such conditions, when the patient has got a lot of risk factors, or in cases of vaginal atrophy, like in cases of menopause or something, then there is decrease in the vaginal lactobacilli. This decrease in the vaginal lactobacilli, it will cause decrease in the H2O2 and lactic acid concentration, correct? Of course, if there's decrease in all these things, it is going to raise the vaginal pH. It is going to make it more alkaline. It is going to increase the pathogens or the microbiota, which is not required, which is going to cause vaginitis. And finally, it is going to lead to the vaginal discharge and vaginitis. Not only that, unfortunately, this vaginitis is not something which will remain to vagina. It may go up. It may cause PID, which is pelvic inflammatory disease. Again, it may cause infertility affecting the tubes. Again, it can cause STIs, correct? So what do the patients come to us with? So the patients, they do have this fish-like smelling vaginal discharge, right? Many of them, they may not even say that. Some may just say that there's a heavy vaginal discharge, so which generally gives us an idea that it may be bacterial vaginosis. Sometimes they say that it is greeny vaginal discharge, which gives us an idea that it can be a trichomonas vaginalis, right? Sometimes patients, generally, most of the times, they do always tell you itching is something that the patient never forgets. So most of the times they'll tell you that it is itching around the vagina, there'll be swelling, there'll be irritation around the vagina. And again, it may also be associated with urinary tract infections. There may be pain during the intercourse. Also, it is going to cause a lot of other problems, like she may be complaining of a lot of itching and swelling around that area when they are sitting specifically in that position. So specifically then, these patients, they do complain of having these symptoms, and it can be very disturbing and very irritating, specifically because a female who is working, because she really has to, it really affects her ability to work, correct? So what are the causes which will cause disturbed vaginal pH? So one is the menstrual cycle. Menstrual cycle is something which is going to affect the vaginal pH, because every time the blood which comes up during the menses, it has got a pH of 7.4, correct? So every time it remains there, it is going to change the pH of the vagina, and it is not going to let it remain acidic. It is going to increase the pH and going to add to the chances of vaginitis and the other microbiota, which is not important to the growth of that, correct? Again, there can be some medications like antibiotics, which we take up. Antibiotic medications can also increase the vaginal pH. Douching, which is cleaning of the vagina. Again, that every time you clean the vagina, you are going to remove all the required microbiota, the lactobacilli, and that again is going to increase the pH. Lubricants that are used while having intercourse, again, that is going to change the vaginal pH from acidic to alkaline. And specifically in breastfeeding and menopausal women, where the estrogen hormone is less, right? So specifically in menopause, where estrogen is going to, as we have seen, estrogen is going to add lactic acid by creating more glucose and then converting it to lactic acid with the help of lactobacilli. So if that is hampered, the whole cycle gets hampered, and it causes increase in the alkaline pH of the vagina and increase in the chances of vaginitis, and same with the breastfeeding women. So we currently, as doctors, we know the treatment of vaginitis, and we have been taught about this since very first year of our medical studies, that we have to use antibiotics, we have to treat it with agents. So most of the times, if it is a fungal infection, we do use clotrimazole creams, we do use tablets of fluconazole, right, for fungal infections. We have been told to use tablet metronidazole, again, which is a very important treatment part. Okay, so again, tablet metronidazole can be given for 7 to 14 days, specifically in cases of bacterial vaginosis. Clindamycin, again, it has come up as the main line of treatment of bacterial vaginosis. Again, the other antifungal treatments like miconazole, nystatin, all these treatments we have been using for a very long time, and they do treat the vaginitis, they do treat the infections, but there's one problem, that it keeps on recurring every now and then. So although they cure this infection, but the disturbing part is that there is always a recurrence of this treatment, and the patient comes back to us and says that this treatment has worked, but it has come up again. So how to tackle with that, with those conditions? So hetero healthcare has come up with a specific kind of treatment for that, and we need to have something that is going to act for a very long time. But we have got washes, we have got all the other types of tablets, suppositories, we have got vaginal gels, and many other things, right? So why go for the film, right, which is a new thing? So basically we have got washes, and this wash, what they do is they just remove the whole of the microbiota, and that is again responsible for recurrence, and that is every time the microbiota has to be formed again, correct? So it just removes the whole of the microbiota. The suppositories, once they are put in, they are very messy, because what happens is there's again this suppository part which is coming down. Again, there's a foreign body sensation with the suppositories. Vaginal gels again are very messy. Putting that vaginal gels again is a very big thing, because patients, they do end up losing a lot of gel, okay, outside the vagina. Most of it is not put inside the vagina, and also the whole of the dosage is not covered, and it is not absorbed in vaginal gels, right? So also in the capsule parts also, so as the same thing, that there is a lot of foreign body sensation, specifically in the soft gel capsules. Also, they are not flexible, so that again is a very irritating part. Patient has to get adapted with that part, that yes, there is a gel inside it. So it can be really irritating sometimes. So that is why these treatments, whenever these treatments are given, the patients, they do come back, and we have seen that there's a little less compliance, specifically with all these types of things that we have been giving up till now. So the next slide. And that is why this lactic acid vaginal films, which is called as Celero, I have seen that there are a lot of things that have been covered with this lactic acid vaginal film. One is that there's no leakage, correct? So the things that happen with the suppositories, they do leak, but in this films, there's no substance that is going to come out, and it is going to stain your panties, right? So that is one very good thing. Again, this patient is very comfortable with putting this film inside. It is very easy method to put. Again, the storage is very easy. It is very convenient to apply this. Again, there is fast drug release with this film. And finally, it gives us the exact result, the exact dose that is required. Plus, it doesn't give any foreign body sensation, because there is more flexibility to this film. So we can see that somehow this film has worked very well in most of the patients, and the patients, they do say that there's less recurrence since the time they have used this film. Specifically, some of my patients, when they came back, they said that most of their problems, most of their irritation, and the other things that they really felt with the other kind of medications, they were reduced. So Celero. So Celero has got lactic acid, which is, of course, which we have been speaking until now. It is required to maintain the vaginal health and the vaginal pH. The fructose oligosaccharides, the FOS, which prevents the growth of the other bacteria and helps in increase in the growth of the the good bacteria, the lactobacilli, and helps to maintain the pH. Again, it has got tea tree oil, which is an added benefit that has been mentioned. And they say that this tea tree oil is going to reduce the vaginal thrush. Okay, so how to use this Celero? Because again, when these films came to me, I was actually very much enthusiastic, and I was very anxious to know how to use this film. So first of all, the first thing that we always tell the patients is, first of all, wash your hands. Then there is this film. You need to remove the upper part of the film and then take the film on your hand, on your fingertip, and roll it on your fingertip and sit in a comfortable position where you can insert it inside the vagina and just insert it in the vagina as we do it with the other suppositories. Okay, so can I be seen? I have this Celero with me. So I may also show how it is used. Okay, next slide, please. Okay, so the dosage is how to use it. It can be used one film at the bedtime for at least 5 to 7 days. Okay, so that should do the work, and the patient generally doesn't come back with the problems of recurrence. So until now, it has really satisfied my patients. My patients have got very good results, and they were really very happy to see something which is less discomforting, which is very easy to use, and they don't realize that there's something inside the vagina which is working very nicely. So this film gets absorbed inside the vagina. It doesn't come out. So again, that is a very good part of it. Right, so there's no wastage thing. There's no staining part. Okay, so that again is a very good thing. If I can be seen, I just want to show how this can be used. But before that, if there are any questions from the audience, I'd be happy to take.
Yes, madam, there are questions. If you would like to show the film first, you may show it, then we'll go to the questions.
I don't think I can be seen. Can I be seen?
Yeah, we can see you.
Okay, fine. So this is, so actually I don't have a Caesar with me right now because I'm sitting in my clinic, but generally after washing you have to just, this part needs to be cut with the Caesar, of course. And once this film comes out and you have washed your hands, this is how the film is. It needs to be rolled on your fingertip and just needs to be inserted. Right, so this is how thin the film is, and I'm sure that this kind of thing, it is very revolutionary, I must say, because it is not going to give any kind of, that is, patients are very worried about the foreign body sensation. So I think this is going to be very useful, because that is why most of the times patients avoid using tampon also, because it gives a lot of foreign body sensation to the vagina. So, and this is something which is going to act on a hole. It is going to get absorbed on a hole, and there's less recurrence. There's complete dosage which is provided, and there is very good compliance. Please, I'm sure that all of you will be using this. It has really helped my patients, and I'm going to see to it that this is used as the first line of treatment, specifically for my patients, just to help them maintain and to prevent the recurrence of vaginas.
Thank you so much, madam. It's very informative. We really realize, that with this season, the incidence of infections are going to be high, and possibly the film could do well with this type of. There are few questions. I'll just run it with you all. How common is vaginitis in diabetics?
It is very common in diabetics specifically, because we know. Correct. We have just seen that slide where estrogen is hormone is going to act on the glucose, and glucose is going to convert it to the lactic acid, right? So Correct. We know that there's a very high amount of glucose specifically in diabetes, and there's a very high chance of fungal infection again, because the immunity is less. So we know that fungal
absolutely
in diabetics. So
diabetics, yes.
I can say that there's double the chance than a normal patient in diabetics of vaginitis.
And patients on corticosteroids, how you would feel it, including inhaled corticosteroids?
So of course, any patient who has got reduced immunity,
Immunity, yeah,
inhaled,
basically
not
it.
inhaled corticosteroids. Inhaled corticosteroids, they generally do not affect the immunity that much. The
Micro
oral
amount will be absorbed.
corticosteroids,
Yes.
yes. The oral corticosteroids, they do. Yes.
Yes.
Someone who is on
Yes.
steroid for a very long time orally
Correct.
for
Correct.
condition, the immunity is going to be low and the fungal
Absolutely.
infections are there to attack the vagina, of course.
It is, how long would you prescribe the film for best results? You said 5 to 7 days, but would 5 be better or 7 be better? What is it like?
So it all depends on how your patient,
yeah,
whether
yeah.
the patient is having compliance, if she can
Yeah.
take it for 5 days.
Yeah,
So again, that is
correct,
a very
correct.
important thing.
Yeah.
Also, it also depends on what the patient is complaining. If the patient is having a severe infection, you should always
Yes.
try for 7 days initially, right? And if you find that the infection is milder and she is going to benefit from 5 days, you may try 5 days also. So 5 to 7 days, it should benefit the patient.
Like we suggest it to be used at bedtime. Would it make any difference if it is used during the day? Of course, maintaining the same time every day.
It really won't make any difference because there are so many benefits to it. As I just said,
Correct,
someone
correct.
is going to a job, and if she puts a film
Yeah,
inside,
yeah. Correct.
so it's not going to affect it.
Affect.
Why? Because there's no kind of, that's what I'm saying. So there's no staining out of it. There's no fluid that is going to come out of it. That
That's
is
right.
one important thing.
That's
Again,
right.
there's no foreign body sensation of it.
Correct,
So if
correct.
someone is on job, she can comfortably
That's
use
right.
this. Why bedtime? Because patients generally, they do remember
Yes,
to
yes.
to put it during the bedtime. It is an relaxed part of their lifetime, so that is, it becomes easy to tell at the bedtime. But otherwise, no problem to take at the same time, even in the morning also.
Okay. Would you prefer a vaginal film over vaginal tablet or say gel?
Yes.
Because the possibility of the advantage of not being messy and
not being messy, and yes, and gels, most of the gels, once the patient sits or stands up,
okay,
just after putting the gel, most of it does come out. I've seen. So
yes.
It is always better to use this films.
And suppose if the patient, would you use it, I'll word it properly, would you use it along with a concomitant treatment like clotrimazole, vaginal treatment and other vaginal pessaries?
I'm not very sure because I have not used it along with other treatments. I have used it prophylactically and specifically in those patients where it can be used. But I have given them oral tablets along with this. But, so I don't think these two things should be put in the vagina.
Yeah.
One point of time. So it is.
Would it? I mean, this is a very general question. Would use of this prophylactically delay or postpone or even abort treatment like clotrimazole or any such thing?
Of course,
antifungal or anti.
You are maintaining the pH. If you're maintaining the pH, if you're keeping your vagina healthy, it is always going to delay the vagina.
And the need for specific treatment.
Yeah, so anybody who feels that there's some kind of problem, or if she's feeling that I may come up with this, if even if it is used prophylactically, it is still going to help that patient.
That's right. Like patients or estrogen or deficiency of estrogen would lead to these infections. Like patients on estrogen inhibitors, like anastrozole or letrozole for breast cancer, they would also be prone, I suppose.
Yes, of course. Yes. Anyone who is having this problem related to the estrogen hormone, they are more prone to have a vagina.
This type of infection. Another question was, is it used? Would it interfere with episiotomy healing?
Why should it do that?
It wouldn't.
No, it wouldn't. Because healing part of the episiotomy related to the muscle and
correct. Mucosa.
Yeah.
And how safe is intimate hygiene during pregnancy?
Pregnancy is the most important area of a female's life where vaginitis is the most common, because there are so many things that are going to happen. There's less chances of maintaining the vaginal hygiene specifically in that time, because you're so much surrounded with the other things plus the abdomen.
That's
It gets
That's right.
so it
Now,
was difficult to actually work on that area. So, and specifically pregnancy is an area where vaginitis is, the patients are prone to have vaginitis. Correct. Bacterial vaginosis
that's
is a
right.
very common problem which causes preterm labor in the second trimester. We have seen that bacterial vaginosis causes preterm labor. It causes PPROM
Correct.
in the
Correct.
second trimester. It is very common in pregnancy. So, of course, this is something. See, you are not taking tablets. You are not taking antifungals.
That's right. That's right. So they're
It is
topical.
effective. Yeah, it is so effective, specifically in
And
pregnancy.
even in IVF, I suppose there are many doctors who give lactic acid treatment first, topical lactic acid, before they actually start with IVF.
Yes, we do give it because
Yeah.
it gives so much of good surrounding environment for the
Correct.
sperm to move
Correct.
inside. So that is very important.
The
To
local, the local eating was
the local environment is so important for the sperm to actually get inside
absolutely.
the uterus.
Of course, it's too early to ask, but what is patient experience in terms of effect and
So as I was saying, this is just launched product, and it has been used on very few patients until now. But yes, I have tried to use it on as many as possible. And most of them, say around 50% of them, when they came back, they were very happy with the product.
Very good, very good.
Of course, it has helped. It is going to help because it has got the things, the contents are going to help the vaginitis. But what I'm actually happy with is the compliance of this product.
That's right.
The comfortability that the patient experiences with this product is something which I really feel is very good about this product.
You know, our whole endeavor is always to improve patient compliance because that will ultimately lead to better clinical outcome.
Yeah. Because we do prescribe, as doctors, and the patients, they do take for 2 days, 3 days.
Absolutely.
Once you put up suppository, it is going to come up, come down. All the thing is going to come down. So patients are like, "Tisre din se I will not take." So
correct.
third day infection cures, they are not going to take it for other day.
Absolutely.
Come up with recurrence, and then we say, no, it has not worked.
Thank you so much, madam. It was a wonderful session. If there's anything more, we will come back to you. It was a lovely session. Thanks once again.
Thank you so much again, the Hetero Healthcare whole team. Thank you so much for having me. And keep making such products, keep making patients also comfortable.
Certainly. Thank you.
Thank you so much.